So this is Nursing 211 Lab, and I'm Marybeth Aasen, and we are at the Bayshore campus, and it is Wednesday morning. So, getting back to talking about initiating IV therapy. So first of all, do we need an order for an IV?
Yes.
Does anybody remember how IVs are typically ordered? The doctor orders. I guess what I'm looking at is you'll either see an order for the type of solution at a certain rate. So for example, D5LR at 100 milliliters per hour, or you may see an order to infuse a liter over a certain amount of time. A liter of D5LR, the type of solution always needs to be identified. But hence why we need to do our med math calculation problems that we've been working on. So you may see it ordered either way. But yes, we definitely need an order. So when we are talking about initiating IV therapy, some of the supplies that you will need are going to be your IV catheter, and I have a couple examples here. You may see this referred to as a venous access device, angio catheter, IV catheter, all those mean the same. And so you will have your catheter. On the back of the catheter, typically just like with our syringes, you'll have the size and the gauge. So you need to pick the appropriate size and gauge. We'll talk about that in a minute. You need some sort of supplies to start, and some places have IV start kits. So I have an example of that here. And in this IV start kit, we have our tourniquet. So in the start kit, we have the tourniquet, we have the tape, and then ChloraPrep, which is the recommended cleansing agent. I mean, some places still use alcohol, but we do recommend, CDC recommends ChloraPrep. So we have ChloraPrep and then Tegaderm dressing. So I will say places I work, they don't always have these start kits, so then you just need to gather the supplies that you need. So we need the catheter, we need the IV start kit, we need gloves, of course, hand hygiene, and then you may start the IV with either the fluid running, so you would have to prime the IV tubing, which we'll do in a bit, but most IVs now are started with what we call IV extension kits or J-loops. Anyone else know what these are called, like where they work? J-loop, is that what you hear? Or IV extension kit. So this looks like this. This is the J-loop. And this part goes into the catheter, and then this is the needleless cap. So we need that. If you are starting your IV with the J-loop, you would also need to flush it with saline. Typically, these are the examples of saline flushes that you'll see at the hospital. And by the way, these are considered medications, so there would need to be an order. Even when you're flushing your IV on the floor, you do need to remember you got to triple check. So just a reminder. So we have our what we're infusing, and then of course we would, if we are maintaining the line, we would maybe have it on a pump, or we would be controlling it with the roller clamp. So either way. So.
I have a question.
Yeah.
When I was watching the video, and this was one of our questions, I think, on our quiz.
Yeah.
Is you had to also have the mechanism that holds the IV.
Oh, the stat lock. Yes.
So is that another thing that we would do, or not?
So great question. So stat locks, is everybody familiar with that term, stat lock, or not? So it is, I have a picture of it. A stat lock looks like this. So securing the IV is super important. It prevents vein irritation. It can prolong the life of the IV. So a stat lock looks like the picture on the top. Now, not all places use these, and I think they are more expensive. Some places where you work, you may just stabilize it with a Tegaderm and tape. There is research that shows that stat locks may help the IV lasts longer. So ultimately, it might be less expensive, but you know how that goes. So stabilizing it is important. So it kind of varies depending on where you work, whether or not they even use the stat locks. But good question. So yeah, stabilizing is super important. So a couple things about, before we get into the actual procedure. I'm sorry. I want you to take a look at the IV catheter. I'm going to point out a couple things. So the IV catheter, as I said, the size is on the back. This is a 22 gauge, 1 inch. And there are, a lot of different types of catheters, but this one, they have some commonalities. So basically the catheter is over the needle. So the needle is what we use to insert it into the vein, and then once we're in the vein, we advance the catheter over the needle, so only the catheter is left in the vein. This has a safety device right here, this white button, which is just like our safety devices on our syringes, so helps to prevent needle sticks. You can see that one thing I want you to notice, because this affects the technique for inserting the IV catheter, is that the tip of the needle is protruding a little bit out of the catheter. I'm going to pass this around so you can take a look at that. So when I'm going through the steps, once you get your flashback of blood, you just have to advance the tip of the needle a little bit to make sure the catheter gets in the vein, and then you can withdraw the needle, if that makes sense. It makes more sense when we go through the steps, but so the flashback chamber is this, so you may see blood here, but oftentimes you'll first see the flashback of blood right in the catheter itself. So when we talk about putting in an IV, is this do we use a sterile technique or not?
No.
Anyone else?
It depends, I thought.
So when we think of sterile technique, I think when we think about like fundamentals, we think of like putting on sterile gloves and maintaining the whole sterile field. We don't do that, so you are correct that way. However, we do say that we use surgical asepsis because we do need to maintain the sterility of the catheter, the needle, any connections, and the fluid that is infusing. Just kind of like with injections when we talked about maintaining the sterility of the needle. So does that make sense? So we do say we do use surgical asepsis so we do need to maintain the sterility of that. Now, I'm going to pass around a couple of these catheters right now so you can just take a look. So the pink is the 20 and the blue is the 22 gauge. So if you want to take a look. Yeah, the white button on these, don't press that right now. That is the safety guard, and so the needle will retract, so we can't reuse it. So for practicing today, we'll, that always happens. I say, don't press the white button, and sure enough.
I'm so sorry.
No, that's okay. Does happen a lot.
Okay, I'm not gonna
Here you go.
back on. Okay.
So, yeah. And we, always, of course, in real life, I always want you to press that white button, but yeah, no problem. So, catheter sizes, anywhere from a 16 gauge to a 22 or 24. Now, 16 gauge is really large, like our 18 gauge catheter for injections. So not use that often in a situation where you need to give patients a lot of fluids, trauma. I mean, surgical patients, maybe if the patient's not doing well, but 18 to 20 is common for surgery. Some hospitals require 18 gauge for blood. Otherwise, 20 is okay. And then 22 to 24 is usually fine for maintaining fluid, giving IV meds on the floor. So be aware of those sizes. And by the way, you choosing the size of catheter, that is not written in the order. So that's up to you using your judgment, critical thinking. You need to choose what size for the situation. So for example, if somebody's getting IV antibiotics for, every 8 hours for 7 days, what would be a good size catheter? Which one?
What was the question? I'm sorry.
So if the patient is getting IV antibiotics, so they're in the hospital just for IV antibiotics, like every 8 hours for 7 days, what would be a good size catheter?
22.
The 22 or the 24, exactly. We don't need a large gauge, right? We don't need a 16 gauge. We just need a small catheter to infuse those medications. The midline catheter, I just want you to be aware of that. The midline catheter is a peripheral catheter that you may see in some hospitals. The advantage of a midline catheter is it can stay in place for longer than the peripheral catheter, which these peripheral catheters typically most places are good for, like, does anyone remember from the ATI how long they're good for? 3 to 4 days, typically. Yeah, 72, 96 hours. They're usually, some always go by the policy, and of course, by your IV site assessment is what we'll be looking at. But the advantage of the midline catheter is that it can stay in place for 1 to 4 weeks. So, yeah. Now, I need to. So getting back to initiating IV therapy, what are some things to keep in mind when you are choosing a site? So, you get the order for the IV, and then does it say, like, put it in the right forearm, put it in the left forearm, put it in the antecubital space? No.
You won't do it if there's like redness.
Very good.
irritation, Lesions.
Good. Anything else that you're thinking about?
Like good blood flow.
So you don't want to have it in a place that the flow may be affected. For example, like if you put it in the antecubital site, whenever the patient moves their arm, it's going to be positional. Now, sometimes it is appropriate to put it there if, for example, during a test or a procedure where you just need a good IV for like an hour and then you'll take it out. But yep, so if it's an IV, for example, for the medication administration, we really wouldn't want to choose here. It would not be our first choice. I mean, sometimes we have no choice because the veins just aren't that great. But so yes. So what else are we thinking about when we're choosing a site? Think
Well,
like,
it depends on if it's a child or an adult.
okay,
For the children, it's on the foot or the head.
for like an infant,
Yep.
right, yeah. I mean, the other thing,
I'm sorry, I'm thinking out
go,
loud.
go Nina.
Your dominant hand, you're not going to put
Exactly,
it on your
yes.
dominant
So
hand.
that is something I would always think of. I'd be like, are you right-handed? Are you left-handed? And choose the non-dominant if possible. So the other things that you probably read about were, if you remember, like if somebody, you'd want to know if somebody had like a limb alert,